Hello, welcome to part two of chapter one, where we'll start to go into regional anatomy and directional terms and body planes. So lots of terminology in this section, worth taking notes on or making flashcards for this terminology. So we have two main ways that we can separate the body. These are just very overarching terms for the two main portions of the body until we start to get down into each individual body part and it has its own kind of naming for it. So for the head, neck, and trunk region, so anything in the head, chest area, abdomen area, all in between. This is called the axial portion of the body. So anything kind of in the center of the body, excluding like the arms and the legs, is considered the axial portion of the body. If we do look at the arms and the legs, and this includes the shoulders and the hips as part of this, we would term this the appendicular portion, highlighted in purple in this picture, which includes the upper and lower limbs. So these are two big distinctions for the portions of the body. Anything, again, in the head, neck, and trunk is axial, and anything that is upper or lower limbs is appendicular. So we've got those distinctions. Not only do we have those distinctions in the body, but we also have several cavities in the body. So this would be hollow areas that are filled with internal organs. Okay. And it's important to note, I used in this previous picture bones, okay? Bones are a great way to show the distinction between the axial and appendicular portion. And when we think about body cavities for this next area, the bones protect these body cavities. So the bones will be kind of the outside structures, and then the inside is hollow, right, for the body cavity, but we are going to fill it with different organs that are protected by the bones that surround them. So for the axial portion, so within the head, neck, and trunk, we have some major cavities. One is the cranial cavity. The word cranial refers to the brain or your cranium. So the cranial cavity houses the brain. Okay, protected by the skull. Inside it is the brain. Your spinal cavity, also called your vertebral canal, is where the spinal cord is. This is a pretty small area. You have your vertebrae, which are protecting this cavity, and then the spinal cord, which is fairly small in the body but very long, is going to run through this vertebral canal or spinal cavity. Moving a little bit further into kind of the abdominal and chest region, we have the thoracic cavity. So this is in the chest. It's protected by the sternum and the ribs, but it will house organs like the lungs and anything we call thoracic viscera. Anytime you see this word viscera, this just means internal organs. So your thoracic viscera includes the lungs, it includes the heart, okay, and it can include any other structures that kind of make their way into that cavity, like say the stomach or part of the liver. And then when we get lower into our abdominal pelvic cavity, there's not as many bones there that actually protect this cavity, right? It's very open and exposed, but it is going to contain all of our abdominal and pelvic organs, or what we would call viscera. So these are some pictures kind of to show that. Okay, so cranial cavity housing the brain, vertebral canal or spinal cavity housing the spinal cord, thoracic cavity we can see from this side view, but also from this anterior view, housing different organs, right? Our lungs would be here, our heart would be here. And then when we move into this abdominal pelvic cavity, we have areas for our abdominal organs and our pelvic organs. So let's get into some more kind of more specific terminology. So we know we have appendicular and axial parts of our body, and we know that there are different body cavities, but we can also use a lot of different terms to talk about the direction of whatever organ or structure we are looking at. And there are special terms that we use. One, we never use directional terms without assuming a reference point, and that reference point is typically going to be anatomical position. And this person in this picture is standing in what we would call correct anatomical position. So she is standing erect, she's facing forward. upper limbs are at the side, right? Her palms are facing forward, okay? Feet are firmly planted on the ground. I did use this person. This is a yoga pose called mountain or savasana. And again, it is demonstrating just correct anatomical position. So whenever we refer to a patient or any of our structures in the laboratory, right, we are thinking about them being in this correct anatomical position when we use directional terms. This is what your book provides, right? So this person is in correct anatomical position. So from this, relative to correct anatomical position, we can infer a lot of directional terms, okay? These ones are fairly easy, like left and right, okay? But we're going to get into some more specific terms, things like proximal versus distal, medial versus lateral, superior versus inferior, and then we have anterior or ventral on the front and posterior dorsal on the back. These are all directional terms. And when we refer to a patient or a structure, any kind of thing, we want to assume that it's in correct anatomical position so we know what we're looking at. So this is my cat Pikachu, and I'll be using him just a few pictures just to show some anatomical positions. Okay. So one of our ones we were looking at was ventral or anterior. These can be used interchangeably, and I am fine with you using them interchangeably on any of your exams. And then we have dorsal or posterior, also the same, so you can use either one. So let's look at dorsal or posterior first. This is referring to the backside of the body, okay? And you saw in the previous picture, right? If we have dorsal or posterior, this is referring to the back of the body of this person. So the back of the body on Pikachu, right, we would refer to as his dorsal or posterior side. When we switch to the front of the body, if we use the word ventral, it actually has another meaning other than front. It also means belly. Okay, so the belly side. Um, and again, that word anterior, which we can use interchangeably, would be the front of the body. Very, very similar to this picture with this person, right? This is the front of her body. It's also the ventral or belly portion of the body. More directions. So we have proximal versus distal. Okay. Proximal means close to the body. Maybe even we might think of a reference point close to the midline of the body. Proximal would be closer to the body. Okay. And then distal would mean distant, farther away from the body. Doesn't mean that the body part's not attached or anything like that, but it is farther away from the midline of the body. A lot of times when we think of body parts that are distal, we think of the hands and the feet because they are attached to the body, but they are not close to the midline. They are distal or distant, farther away. Versus other body parts, like, say, our shoulders, right? Our neck, our thighs, things like that, closer to the body's midline. So we would call those proximal. Few other terms. So we have lateral versus medial. Lateral means away from the midline of the body. And this could mean when you are moving the body, you might describe your movement as either lateral or medial. Lateral meaning to move away from the midline. So Pikachu's side of his body, he's a little chunky, maybe his tail here. This is lateral to the body. This is away from the midline, okay? And we could also refer to it as distal, although we don't use these terms interchangeably. Medial, on the other hand, would be towards the midline of the body, okay? I could think of this more in regards to movement than anything else. So say I have my arms by my side. If I move them away from the body, say I'm going to open my arms for a hug, that's lateral. That's a lateral movement. I have moved my arms lateral. If I then bring my arms back to the side of my body, they are now moving more medial towards that, towards the midline. So let's get into not just those directional terms, which we just looked at, and we have a few directional terms to go. We have superior and inferior, okay, and superficial versus deep, which we'll take a look at. But I want to introduce to you to some body planes. These are invisible lines, right, that can separate out the body, and they don't become so invisible if you were doing, say, a dissection, right, when you need to cut along these body lines. So our first body section or plane is called the sagittal one. it's longitudinal, okay? So longitudinally, we would cut the body into left and right portions, and we can introduce different terms for sagittal, like mid-sagittal or parasagittal. Mid-sagittal means that when we divide the body into left and right, they are in equal portions. So we can see with Pikachu here, directly down his midline, this would be a mid-sagittal plane, separating him into equal left and right portions. But say we had a sagittal plane, but we did not create equal left and right portions, right? This one is smaller than this other side just based on this plane. We would call it parasagittal, where we are still dividing the body longitudinally or sagittally, but it's unequal left and right portions. So that's one of those, sagittal plane, where we have mid-sagittal versus parasagittal. Most of the time in this course, when we refer to this plane, it's going to be mid-sagittal, equal left and right portions. We have transverse, okay? Transverse is a horizontal section, right? So horizontally this way. And this divides the body into top and bottom portions, which we're going to refer to as superior, meaning above, and inferior, meaning below. So if I have this transverse or horizontal plane on Pikachu, this is his superior portion of his body, which usually includes the head, right, for any organism. And then we have the inferior portion below. The last body planar section is coronal or frontal. This one's a little bit different. You can use these terms, coronal or frontal, interchangeably. I'll use both of them on your exams, okay? But this cut is separating, and if I put my head to the side, it's separating the front and back of the body, okay? So if this is Pikachu's backside and this is his belly front side, a coronal or frontal section or body plane would separate him into anterior or ventral and posterior or dorsal portions, just based on that type of body section. We have additional pictures that will help you with this that don't include Pikachu if that's a little confusing. So you can see this is what your book provides, one of these kind of man examples. And so separating him down into left and right portions is that mid-sagittal plane. Separating him horizontally into superior and inferior portions is the transverse plane. And then we can see right here in the middle here, separating him into anterior and posterior portions is the coronal or frontal plane. We can see this for organs as well. I wanted to give you multiple examples. This one right here, separating the brain into equal left and right portions, is the mid-sagittal plane. This one, separating the brain into superior and inferior portions, is the transverse plane. And then this one, separating the brain into anterior or ventral and posterior or dorsal portions, this is the frontal or coronal plane. So once we get through those directional terms and those body planes, we now start to get into individual body parts. And these individual body parts are, they have names for all of them. And this is where we get to this really kind of big regional anatomy section for this chapter. So regional anatomy is the study of anatomy based on regions or divisions. That's not hard to believe, okay? And it emphasizes the relations between various structures. So muscles and nerves and arteries in that region, they may all be named the same exact thing representing that region. And we want to know regional anatomy because these are the scientific terms that are going to be used to describe body parts in the clinical setting. So we do want to know them. And this is just all part of learning medical terminology. This is where we get a lot of our regional anatomy terms. I have one kind of broken down here. This is one of the terms you will need to know. This is olecranon. It's referring to the back of the elbow. Okay. Olecranon is kind of the root word for the elbow bone, okay? And that al suffix is meaning pertaining to. So olecranal means pertaining to the elbow. And specifically, it's referring to the back of the elbow where you have the olecranal process on this bone. So let's take a look at some of these terms. So here we have, kind of this man that, and we have front and back for him showing his anterior and posterior portions, and he's in correct anatomical position, which is great for us, okay, for looking at this kind of terms. And you can see There's, different points pointing to different areas of the body, all representing a different region that has its own scientific name, okay, for the regional anatomy. And I know that you'll be learning a lot more about regional anatomy for the laboratory portion because a lot of those terms are going to be on your first lab exam as part of your lab list. So make sure you check that out. And RTA for the class, Ryan, will also be going through these. But we can kind of just look at these different body portions to see a few terms that kind of stick out. And if we kind of stay within the head, neck, and trunk region, which you should know as axial now, we've got a lot of terms in here, right? Kind of the front where the forehead is referred to as frontal. Anything pertaining to the head could be considered cranial, right, where the brain is, or we also use another term, cephalic, for head. Few additional terms, right? You might think of the cheek with that word buccal. Every time you go to the doctor, say you were, you probably don't do this at the doctor, but say you needed to get your DNA swabbed, okay? It's called a buccal swab because they are swabbing the cheek, right? And the word buccal means cheek. The word oral means mouth. The word mental means chin. So we've got some terms in here. Working our way down, you might see the neck, which is referred to as cervical, usually, okay? Not referring to the cervix in women, but referring to the neck, cervical. You might have different areas of the chest, right? This whole chest area is part of the thoracic cavity. So we actually do refer to the chest as thoracic, but based on certain parts, right? You might have certain regions where the pectoralis muscles are. So we call them pectoral, where your sternum might be in the middle. So we would call it sternal. Your belly button, where your umbilical cord used to hang out, is called your umbilicus. Okay, so umbilical would be the term for that. And we use the term for abdominal for the abdominal compartment, right? There's lots of terms in here, right, to refer to. We could look into the other part of the body, which is the appendicular portion, right? We've got lots of words that we might use to describe the arms and legs. Brachial is a really good word to describe the arm, okay? We already looked at one previously. So for elbow, okay, and for your book, it's kind of showing this term antecubital, anti meaning in front of, like anterior, cubital referring to the front of the elbow, antecubital. And if you wanted to just refer to the elbow in general, you could call it cubital, but we have a term for the back of the elbow, which is olecranon. So lots and lots of terms, okay, to go through. And you'll know what terms we're referring to. You guys have a study guide for this course, which will help you prepare for your first test, and it will use some of these terms that you'll be aware of as we go through. So this is a good picture from your book showing a lot of the different regional anatomy terms. A few on here, okay, that are a little bit more brought out, okay? Some common ones for the axial body. We just kind of went over these a bit, but this is kind of breaking it down into a larger, maybe more specific picture that might be easier for you to see for some of these terms, okay? Same here for the trunk region, which is kind of highlighted in red, lots of different terms. We also, again, have terms that we would use for the appendicular, things like olecranon, more specific for the back of the elbow, versus antecubital, meaning the front of the elbow. Um, Most of you have probably had blood taken in your life, right? Okay. And you know that it's taken from kind of your elbow region, right? In your arm, typically, okay? If your veins are large enough, right? And they're able to pull blood from there. And the vein that they're pulling from is your median cubital, referring to the elbow, again, right in that region. We've got other terms as well, right? Your shoulder can be referred to as acromial. This is referring to a bone in that area, a bone structure in that area. It could also be referred to as deltoid, okay, which is where that muscle is. Brachial in general means the arm. And if we want to go to the forearm, kind of more in front, we would call it antebrachial. Any of your wrist bones are referred to as carpal. Any of your hand bones are metacarpal. And then you've got digits, digital for your fingers. A few different ones for the legs as well. Anything that refers to your hips is called coxal. Your thigh is referred to as femoral for the femur bone that's there. Your knee, if you've done some of the study guide stuff or some of the homework, you'll notice there's some different naming for the knee. The front of the knee is called patellar because of your patella bone that's there, and the back of the knee is called popliteal for the blood vessels and nerves that are back there. The front of the leg is referred to as crural for your front, your shin area, and the back, the calf, is referred to as sural. When we get to the ankles, your ankle bones are called tarsals, so they're referred to as tarsal. Foot bones are metatarsals, and we still have our toes as digital, our digits. We have some specific names for certain bones that come from the ankle bones, like your heel, which is referred to as calcaneal. So let's continue just a little bit more. I wanted to add in that superficial and deep that we have not gone through, okay, because we've gone through a lot of regional anatomy. Here's Pikachu again. Hopefully the regional anatomy hasn't been too scary. I know it's a lot of terms. Um, so these other two terms, superficial versus deep, I do want you to know them, okay? Superficial means towards the body's surface, right? Someone who is considered superficial only cares about external appearances, right? So this would be the most external, superficial. So on Pikachu's body, his hair and his skin is superficial, right? That's at least from the whole standpoint of looking at his body. This could be based on a reference point as well. And then we have the other term that's the opposite, which is deep, towards the inner portions of the body below the surface. So underneath his superficial surface, which is his hair and his skin, Pikachu has muscles, bones, internal organs, and we would consider those deep structures. One more kind of set of terms, and I didn't use Pikachu for this because it's a little harder, is these terms ipsilateral versus contralateral. This is referring to what side of the body we're on. When we get a little bit deeper into other sections, we might use these terms a bit because sometimes something will occur on one side of the body, but it doesn't affect the same side of the body, right? Could occur on one side, but affects the opposite side, which we would call contralateral. So if we look at these last two pictures here, right? Okay, ipsilateral meaning that what's occurring is going to be on the same side of the body. My right arm and my right leg are on the same side of my body. They're ipsilateral. Contralateral is where we have it crossover, right? We might be referring to the left arm and the right leg as far as contralateral, opposite sides of the body. This happens a lot when we look at the nervous system and how it functions, just based on certain parts of the brain that are affected. A lot of times it's contralateral, it'll affect the opposite side of the body. And so I'm going to stop here. We will have part 3 next week, which will be for the different body organ systems, which we will go through together. If you have any questions, please feel free to reach out to me and have a great day.